New robotic technology comes to Downey Surgery in Bangor. We talked with a local surgeon who explains the process of knee replacement.
We're fortunate that knee replacements are one of the most successful surgeries that are performed. I tell patients that it's still me doing the surgery, and that is accurate. Robots don't replace the surgeon. What they do is they give me more tools and more data to precisely place the component. As surgeons, we always want to improve things even more, and so that's the idea with robotic surgery. Replacement sounds like chop here, chuck it, and start over. The better term would be resurfacing. So in a knee, on the end of the thigh bone, the job in surgery is to make a series of cuts so that the implant fits over, almost like capping a tooth. So that's on the end of the thigh bone. You keep your own ligaments on the side, you keep your own muscles. On the shin bone, same idea. Make a flat cut, place an implant, almost like capping a tooth. And now instead of rough surfaces, you've got smooth surfaces to move back and forth.
And is that where the pain arises, is when you don't have smooth surfaces for people?
You got it. Arthritis isn't the addition of something, it's the wearing away of cartilage. And so that you go from smooth on smooth to rough on rough.
Look at that, learning something here.
So you got your registered?
Yeah, we're registered, you can find that.
The first step is for the computer to find out where the center of the patient's hip is. And so I will move the limb around, registering various points, and it will mathematically determine the hip center. Next, we're going to have the computer learn the patient's anatomy, and this is truly the flow that I would take in the operating room. The computer will then plot all these points. With this system, there's no advanced imaging necessary, meaning that you don't have to get a CT or an MRI scan. You're going to use regular x-rays. And so at this point, we've plotted out all the points, and then we're going to check the patient's ligaments, check their range of motion, and now I'm looking at all kinds of data. That data is telling me what parts of the joint are tight, what parts are loose, and now through the computer I can make adjustments in position of my cut so that that data looks the way I want to, meaning that I want the tightness of tissues on the inside of the knee to be similar to the tightness of the tissue on the outside of the knee. Thank you. The next step would be for the robotic arm to come in with the cutting guide into the position we want. So Ben, you can bring the arm in. So at this point, I'm going to manually move it the rest of the way, but that arm is going to follow the knee. So at this point, I would bring in a saw and run that saw through the cutting guide to make the cuts on the end of the bone. Once that's done, that bone cuts are finished, and now we've made our first cut. If we're happy with that, we're going to bring this arm out. Now it's going to come in so that we can make a cut on the top of the shin bone, run the saw through the cutting guide, verify all of our cuts, make some decisions about rotation and angle on the end of the thigh bone, and then we're putting in trial components, making sure we're happy with everything, and then put the final pieces in. In reality, we have tissues to move, and there's some bleeding, and there's more time-consuming steps. Overall, a knee replacement takes between an hour and a half, depending on the patient. Using the robotic technology adds a little bit of time, but it also takes away a little bit of time. Total knees have been done for decades. They're very successful. The hope is that this is bringing it to another level, that there are going to be even better outcomes in patients who can continue to get back to the activities that they desire.